I'd like to introduce to you Emily Pipish, our social worker here at the Michigan Parkinson Foundation, who is going to have a panel discussion about caregiving. Thank you, Emily.
Good morning, everybody. Thank you for attending today's symposium. My name is Emily Pipish, and I am the staff social worker at the Michigan Parkinson Foundation. One of my responsibilities at the foundation is administering our respite grant for caregivers. This grant provides funding for the Parkinson's patient to receive care from either a home help agency or an adult day facility so that their caretaker may take a break to tend to their own needs and interests. If you are interested in further information about this grant opportunity, please contact me at the foundation office after this training. Caregiving for a loved one can be extremely rewarding work, but even the most dedicated of caretakers needs time to themselves to recharge. It has been empirically demonstrated that caretakers who take care of themselves take better care of their loved ones. They have a lower likelihood of developing anxiety and depression, and their immune system is less likely to become compromised. It has been proven that support of the caregiver can also delay or even prevent nursing home placement for the Parkinson patient. Our session today, Care for the Care Partner, is a panel discussion with 4 current and previous caregivers. Our purpose here is to discuss how important it is for caregivers to tend to their own needs and to stay healthy in order to be able to better care for their loved ones. Rosalind Carter, the former First Lady of the United States, has stated, "There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver." At any point in time, all of us may find ourselves in a situation where we are responsible to care for a family member. With Parkinson's disease, the average age of diagnosis is 58 years old. This means that an individual with Parkinson's can potentially live for decades beyond the onset of their symptoms and their subsequent diagnosis. As their symptoms advance, the Parkinson patient will come to rely more and more on their loved ones for physical and emotional support. Our panel members today will discuss their personal experiences while serving as a caretaker. It is really important to note that we will be touching on not only the challenges associated with caregiving, but also some of the benefits for both the caregiver and the patient. So in preparation for this discussion, I have sent a series of questions to the panel members that I think will be of interest to you, our audience. We have a little over an hour for the duration for the panel, maybe a little bit less. I know we're running a little behind. And I would like to try to devote about 5 to 7 minutes per question. If one of our topics of discussion is of particular interest to you, we will have time at the end of the panel for questions and for your comments. I would now ask that our panel members introduce themselves.
Jean? Good morning, everyone. My name is Jean Merchant. I have the honor through my Home Instead Senior Care Office in Farmington Hills, Michigan, of caring for 5 to 10 individuals with Parkinson's disease at any given moment. I came to this from a very different career. This is my second act in life, but I had taken care of other family members in the past with a variety of different conditions. And I strongly believe that all of those roads led me to where I am today. And it is quite a privilege to work with the Parkinson's Foundation, both as an executive board member and as someone with a great interest in the subject who does provide care for individuals in the community.
Hi, everyone. I am Eileen O'Brien. I'm from Muskegon, Michigan. And my husband had Parkinson's for about 12 years. He passed about a year and a half ago.
Good morning, everyone. My name is Joan Blunt, and I live in Detroit, downtown Detroit. My late husband passed in '08. He had Parkinson's for about 13 years, and then had a fall and had a closed head injury as a result, which added to it. But I found it to be a very interesting journey that we'll talk about later.
My name is Julia Wall. My father was diagnosed with Parkinson's disease when he was 31 years old, which was 1 year prior to my birth. He lived until he was 78 years old, and so Parkinson's and caregiving has been my entire life and very normal to me.
Thank you, ladies. Can you describe what was your first reaction when you were initially told that your loved one has Parkinson's disease?
Do you want to start now with the other one, maybe?
Julia, if you'd like to start.
Well, obviously, it was part of my normal life and normal activity. Things that were different back then is my dad was the stay-at-home dad, and my mom was the one that was the head of household. I am number 5 of 6 kids, and at that time it was a big challenge, but my mom really tried to fortify as much as possible how normal everything was. She really insisted on, even though my dad couldn't play that role, that we showed him dignity and respect. So that's probably the biggest thing I remember as a very young child, and we continued that throughout his lifetime.
Wonderful, thank you.
My initial reaction, I found out that my husband's older brother had Parkinson's too. I noticed some similarities in the way that they moved. My husband was 70, about 70 when he was diagnosed, so it was later in life. I'm an educator, so knowledge is very important to me. So I sent off for all the information I could find about Parkinson's. And when it came, I started thumbing through it, and I thought, oh no, I folded it all up and put it in a box. I don't think I ever looked at it again.
Yeah, and my husband and I both were educators. So I think what we initially did was we just tried to fortify ourselves with as much information as we could. And then to look back, we started thinking about he actually had Parkinson's way before that because he was a long-distance runner and he ran stiff. And I used to say, why don't you move your arms? You know, you could propel yourself more. And he couldn't do it, you know. So, yeah, it was to get a lot of information together and deal with what we had to deal with, yeah.
I have a beloved cousin in California who passed away recently of Parkinson's disease, and she lived to be well past 90 and was vibrant and full of life and managed her symptoms very, very well. But the parallel for me in life has always been that I have a daughter with muscular dystrophy. And although her condition is not progressive, I've had an interest since she was born 31 years ago in all kinds of mobility issues, accessibility issues, ramps, scooters, so you can ask me anything about that. And I agree with what Julia said. I mean, in so many ways, it's important to just assume that this family member that you love is part of the family, and you're going to do what you do, and they're going to be part of it.
Thank you. Can you discuss a little bit about some of the challenges that you've had with being a caregiver? How did it affect areas of your life, such as possibly your job, your finances, and your physical and emotional health?
Well, some of the challenges I remember being when I was very young, and we do have a lot of young onset patients, so this is a real thing that happens. They don't know how to deal with their children and talk to their children. There wasn't a lot of discussion when I was a child, but sometimes I had a lot of resentment that my dad wasn't out playing sports with me or couldn't do, certain things like that. And that was a process that I went through. And then as I got older and as my dad's disease progressed, I had even a little bit more resentment. Even though I was one of the younger kids, the older kids were out of the house, through college, married, had their own lives, and we were kind of in a situation where we had to really help out, So that wasn't a lot of an emotional turmoil at the time. And of course, too, when you're 18, 19, 21, 22, and you know everything, it's challenging. I have to say my mother is one of the founding members of the Michigan Parkinson's Foundation when it first started at Harper Hospital, and a true advocate. And at that time, there wasn't a lot of information. And when my dad was diagnosed, carbidopa levodopa was not available. It doesn't come with a manual like it does now. It was trial and error.
Thank you, Julia.
Mm-hmm.
Joan?
I really became aware of my role as a caregiver. In our support group, we had someone who came in to address the group. And my late husband was 11 years older than I was. And so this presenter talking about caregiving, he said in about 35, sometimes 40% of times, the caregiver predeceases the patient. And I sat there and thought, 11 years and I'm going to predecease him? I don't think so. So I decided right then and there I was going to do all I could. I wanted to take good care of him, but I had my 11 years in mind. And this is my 11th year, and I'm hoping still for some more. Okay.
Thank you, Joan. Eileen?
So, yeah, I think about some of the challenges. Well, we both retired then at 60 because my husband was scheduled then to have deep brain stimulation. So that was early for us to retire, I guess, as teachers. But then a year after he had DBS, he had a heart attack. So what I found was like having that and then having colds or anything like that can throw somebody back. So, that would bring on a new challenge. But I found from like a nurse who came to our home after he had his heart attack, she suggested, he was getting up during the night quite often to go to the restroom, and she suggested a condom catheter. And I'll tell you, that was like a godsend. I mean, because then I no longer had to worry about him getting up during the night. And so I've shared that with our caregivers group, and a couple other people have also used it, and that was really good. But there were a lot of times that were very frustrating for me, and I would at night, I would just say, pray, I'd pray that I'd be much kinder and much more relaxed with him the next day. And taking time for yourself can make all the difference in the world. Just getting away for a couple hours, it brings you, makes you much more alive and thoughtful and understanding.
So I have a unique perspective because I have not just a personal journey with Parkinson's disease, but I'm in the homes of many individuals in our community in Southwest Oakland County who are experiencing the same things. So at any given moment, we're caring for individuals at all stages of the disease. And I guess the common themes that I see is I'm humbled every day by the people who are the primary caregivers for individuals. Many of them are women, and it's hard for us strong, independent, born-to-be caregiver type women to ask for help. It's so hard to admit we need help, but you have to ask. You have to ask. Everybody needs a break. You've got to ask for help along the way.
Thanks, Jean. That's a really good point. And while we're on the subject, I'd like to talk a little bit more about ways that you all were able to find help. Who were you able to enlist to help you with caregiving? And did you have to ask for that help? Was it offered to you? What did that look like?
In my case, there were a lot of kids, so they were able to help out. One of the things that was frustrating to my mom was that once my dad was diagnosed, all the friends tended to disappear, and they were a very social, active couple before Parkinson's. And that was frustrating to her. But she did end up reaching out and asking people for help, even if it was just a visit. Or to come over and just sit so that she could get away for an hour and maybe attend one of our plays or concerts or something like that. So eventually she did get nursing care to come into the home, and he transitioned from palliative care to hospice. But again, he lived until he was 78 years old, and he did pass away of prostate cancer that he chose not to treat. So, yeah.
Thanks, Julia.
Mm-hmm.
Okay. With my husband, with just being diagnosed at 70, he really wasn't impacted as much with just the Parkinson's. He was driving up until the fall, which caused the closed head injury, and of course that took things to a very different level. After that, he couldn't be left alone because of the possibility of another fall. When he had surgery after the closed head injury, and with that we had home help. I didn't even understand it at the time. I kept getting phone calls from these health care agencies. He hadn't even actually been released, but I've learned since then that the hospital social worker contacts the different agencies saying someone's going to be released from the hospital and they're going to need care. So just, I don't even quite know why I made the decision, but we went with one, Global Health, and a little commercial, I don't know, but they were wonderful. So that was it first. And then as things transpired, I have some wonderful friends, one in particular, who had a caregiver that helped her after foot surgery. And she said, "Oh, Joan, I think you should have this young woman help you." And I said, "Well, I don't know if I can afford it. I don't know, whatever. You know, it takes a bit. You need help, but yet for some reason it's hard to accept it at first. Someone coming in your home, and generally there's a minimum of 4 hours, and there's just a lot that you have to get adjusted to." But my friend, who I know is really a mentor of mine, older and much, much wiser, and she said, "Oh, just try her." It was like the middle of November. She said, "Try her till the end of the year." Well, I would not be here today if it wasn't for that young woman. I mean, she saved my life, and when I didn't even know I needed saving. So I think it's a process. I've found many times people are reluctant to accept help. Many times I've heard female friends of mine say their husband doesn't want anyone else in the house, and that kind of thing. And then women, you know, we tend to feel we're supposed to do it all, and especially in our household. And so having someone come in on a regular basis and do a lot of the things that we have done or feel we should do, it can be difficult, but it is, well, to me, it's life-saving. You know, you think about these caregivers that predecease the patient, so it really makes a big difference. We were fortunate in that my husband, he had retired, he had a pension, he had Social Security, he had savings, because I was very aware of spending money for him, because I wanted to, I knew I was going to need to have some resources when I was up in age. And So I think, and many times, you know, the finances are a real concern about getting help, being able to pay for help, that kind of thing. It's something to be considered and thought about. I also learned, I'm a great believer in mental health support. So I had a therapist, and she said, well, ask, you know, some family members. My husband is part of a large family that they were all basically all here in the area. And even that was hard initially. I don't know why, but one of my nieces, I just thought she was the kind of person who did a lot of things for other people, and I mentioned it to her, and she said, sure, Aunt Joan, she said. I said, because sometimes you have to help him in the bathroom, and you have to do things like that. And she said, oh, I took care of Grandpa, and she said, Uncle Lucius, you know, reminds me in terms of his needs. And she was an educator also. She said, I'll come over on Sunday afternoon after church, and I'll grade papers and just sit with him for 3 or 4 hours, and you can do whatever you want to do. And so that was a really, really big thing. But I don't think I would have asked her if my therapist hadn't suggested it, asking a family member. And it's really, you know, a blood relative of his. But asking for that help was initially kind of difficult for me, but it was very rewarding. And I think she enjoyed being able to help her uncle too.
Thank you, Joan.
So with my husband, I think because he was a phys ed teacher, he had always been really active. So he would bounce back. So he had the DBS, then he had the heart attack, and then 4 years later he had open heart surgery. So all those kinds of things took him back just momentarily. He was like, we did this roller coaster thing. So I didn't feel the need, and when you brought up finances, I guess I thought about that too, because I remember when the therapist would come to the house following his hospitalizations, I'd be out there shoveling during the winter. Everything happened during the winter. So I'd be out there shoveling rather than hiring somebody to come in and, you know, plow or whatever, you know, so that the therapist could get there. But so because I didn't know how long he was going to live and how much, you know, that would go, tap into our resources. And then just maybe a year before my husband passed, my sister from California offered to come out for a week so I could go away with my college roommate. And so we did that for 5 days. I did have a person come in to help with my husband getting up in the morning and showering, and then at night. So that was a big help to her. But it was wonderful. It was like a godsend. It was like, oh my gosh, I'd gone away, you know, it was like wonderful. So I think what I wish is that I would have taken advantage of even a couple days at a time, you know, every once in a while, because it just does so much for the soul.
Thanks, Eileen. That's a great point. Yep. And Jean, if you can also discuss a little bit about Home Instead.
Absolutely. So it is very hard to ask, right, for help. And some families are so blessed they have a large family or they have family in the area. Many of us now, I can speak for myself, I have 3 grown children. 2 of them live out of state, way out of state. So you don't necessarily always have the family resources nearby. The Parkinson's Foundation has a respite program that Emily has talked about a little bit, and I know she'd be happy to talk to you about it some more, but to have that kind of opportunity to reconnect with a college roommate, or perhaps to go to a grandchild's wedding out of state, or to go see a new great-grandchild that was born in California. I mean, what a gift that is for you. And we've been able to participate in the respite program. But again, if you can accept that it's okay to hire a responsible agency to come in and help with your loved one, the hardest part is making that first phone call, right? Mm-hmm. Making the first phone call, asking the questions. And there's many great agencies out there, not just Home Instead. I'm a little biased, but I can tell you that, you know, when someone reaches out to us and they're looking for some help for their loved one, I personally go out, I meet with the family, if they're at the hospital, if they're in a rehab, if they're in their home, wherever home is, an apartment, their private home, an assisted living, an independent living, wherever it is, it really doesn't matter. And I like to go out and really understand their needs and kind of what's going on in their lives. I can look in the eyes of the primary caregiver, whether it's husband or wife or adult child, and get a pretty good sense for, how things are going. And then we work very hard to match up the right individuals with the right clients so that that person, that caregiver, has peace of mind. So they can go out maybe 2 mornings a week. They can go to their own doctor appointments. They can go out and meet a friend for lunch. They can go out and go to their yoga class. I mean, whatever gives them strength so that when they come back in the door, they're ready. They're in such a great frame of mind and ready to take on the challenge. But there are great home care agencies. It's just a matter of getting over the hump, making the phone call. You can talk to 5, 6 different ones, whoever you like, you can call me. But we really are dedicated to helping individuals who are primary caregivers get that little bit of a break.
Thanks, Jean. And I know that Home Instead also does pretty extensive checks on any employees that they hire. Can you talk for a moment about what that looks like?
So one of the things that people will ask about, because you only hear about the bad things, right? You don't hear about the great things. We provide thousands and thousands and thousands of hours of caregiving support every single year. But unfortunately, like in life, and you could have the same experience if you hired somebody off the church bulletin board or somebody that someone else knew. You could have a good experience or a bad experience. You want to make sure that person has qualifications. You want to make sure they have training. And you want to make sure that their background is clean. Let's be honest, right? So any individual that approaches me, I think about them going into a client's home, just like going into my own dad's home who has caregiving support. And from the moment they walk in the door, we are immediately running background checks. So we check with the Michigan State Police iChat database right on the spot. We do fingerprinting. The fingerprints go to the FBI National Database. We get their driving records directly from the Secretary of State, because some of our caregivers do drive clients to appointments or therapy. Obviously, we're doing drug and alcohol testing, and we're repeating that constantly. I've never had a problem. I don't intend to start, but asking an agency that you are talking to how they recruit caregivers, how they train caregivers, and importantly, how they do background checks is very important.
Thank you. I want to change topics for a moment here. So we typically hear that the role of being a caregiver is stressful, it's burdensome. Can you discuss a little bit about how being a caregiver has actually been a positive experience for you, and maybe even some of the unexpected benefits that you've encountered along the way? Julia?
Well, my journey is really something. So, when I graduated from high school, I decided to go out of state to college to get away, out of sight, out of mind. At that point, I had had 18 years of Parkinson's and all the stresses that went with it and how it affected our family. My dad was fired from his job because they couldn't read his writing. That would never happen now because of the American Disabilities Act. So there were a lot of challenges, and my mom was only 28 years old when he was diagnosed. And so, you're a baby when you're 28 years old, so you can't imagine the heaviness that came along with this. So I went away to college, and while I was away, I then developed some depression and guilt. I had a lot of guilt feelings about being away. So I started seeing a therapist at the university, and I was in there all the time, and I was really just dealing with guilt more than anything. So after I finished college and I moved back home, I want to just talk about a therapist for a minute. You got to try a lot of therapists. They're not cookie cutter, and I didn't get such great advice. But when I came back to Michigan, I moved back in with my mom and dad and tried to be a caregiver. I was in the medical profession. I really wanted to concentrate working in pediatrics, but somehow ended up in neurology. but anywhere but dealing with Parkinson's. Until about 22 years ago, when I somehow ended up with an interview with Peter LeWitt. You might know that name. Dr. LeWitt, who is a very notable movement disorder physician internationally. And when I found out I was interviewing with Dr. LeWitt, I was trying to figure out how I could get out of there very quickly. Because I had a fear that I would be seeing my dad in every single patient, and would I be able to be fair, effective, and mostly not so emotional, you know. So I had full plans of politely declining that offer. Well, I just celebrated my 22nd year with him in May. And I know Parkinson's. I know it on a personal level. I know it on a professional level. And it's very rewarding to me. I facilitate the Livonia Support Group, which is on my own separate time, not through my duties at Henry Ford. I travel across the state and educate people. I try to be very supportive. And that has been the single most rewarding thing, besides my children and husband, I should say that, right? I'm grateful for it, for something that I struggled with as a child and had a lot of, I mean, if the therapist knew what I was doing, she'd probably need therapy herself, as much as I was in there. So for me, it's been very positive. I want to reach out to people and be supportive to them and educate them. I like to share the statement that my father, people will ask, how did he last with Parkinson's for so long? And I have to say that he had an amazing attitude. He really thought he was a lucky guy, which was perplexing to all of us. But that's what I believe was because of it, due to his longevity. It was his happiness, and he was inspiring, and I try to inspire people. I try to be hopeful. My favorite saying is, it's a crappy card to be dealt, but it's how you play the hand that matters. It really is. And being here today, participating in support groups, anything that you do to educate yourself and try and get resources is winning.
Thanks, Julia. That was really inspiring. Joan?
I think the main thing that I learned from my journey with my husband, my late husband, was the people that came into my life. Some of the most wonderful people in the Parkinson's support group. I still go. This will be the 11th year. My husband's been gone, but I still go to most of the monthly meetings to support, encourage, and they're just wonderful people. And I think about the caregivers that came into my life, work with my husband. They were wonderful people. I'm still in touch with most of them. There's a couple that I go out to lunch with. I mean, we became friends, and there's one who I think loves my granddaughter as much as I do. She constantly asks for pictures and what's she doing now and that kind of thing. And people who care for people are wonderful people. I think that when you find, I've always said as an educator that good teachers, did I mess something up? That good teachers are born, not made. I think there's certain temperament and personality and characteristic that you have to really be a really good teacher. And I feel that way about caregiving. People that do it well, they are a certain special breed. And it just so happens that I'm caregiving now for the second time. My older son was diagnosed with multiple sclerosis 5 years ago. So caring for his late dad certainly helped. This is much more difficult, by the way, much more difficult. He will be 50 in September. So this is much more difficult than caring for my late husband. But it was preparation. So it's sort of like, well, one part of the journey gets you ready for the next part of the journey.
Thank you, Joan.
Yeah, so because we had, from the time my husband and I retired at 60 until 71, and we'd been married for 50 years when my husband passed. So we had all that time all of a sudden that we could travel. I mean, between his episodes and all, we would travel, and that time was just wonderful. It was just like camping. When we were in camping, it was like our great time together. So, I've got really good memories of that, and sometimes, like when I watch TV show or something, and I think about what expression, I've got those expressions memorized that how he would express himself when he would see something on TV. Had we not had all that extra time together, we would have gone just by like 2 ships in the night. I mean, we wouldn't have had that much time. And also, I learned so much about Parkinson's because Bob would sign up he did the water program twice a week. So I was involved in that. He did the GO program, the LOUD program. I mean, he continuously did this for years. And so I would observe and listen to what the therapist said and everything. And then we've been involved in the total group of the person with Parkinson's and the caregiver, as well as the separate caregiver group. And so I've gleaned so much information, and I feel like I'm still involved. I'm one of the leaders in our group and caregivers, and I'm hoping, that I can continue to maybe help others and offer like respite, and because I know how important it is. So I encourage those people, who are going through the same things that I did. So
That's great. Thanks, Eileen.
So life is very unpredictable, right? I got to this point by an interesting route. I actually worked in the auto industry for 33 years in an almost all-male environment, launching cars all over the world, until my life came to kind of a screeching halt when my mom's cancer progressed to a point where she was under hospice care. So I retired at 55 and had wonderful grandparents and a cousin that I loved and a daughter that I had provided care for, but hospice care was, again, something different in my life. And then my life changed completely. So after years and years of, working 18-hour days and traveling the world, my mom was dying. And it was actually her wish that I would take on this kind of work as my second career. And very mysteriously, in about 5 months after she passed, the opportunity came along in a very unexpected way. So, I just kind of took the sign, and so here I am today, 5.5 years later. So now I'm in a very female environment where I have 70 women who work for me, who are the best people I have ever met, who are caregivers from all different walks of life, all different life experiences, taking care of 50 clients in Southwest Oakland County. Every day is crazy, every day is different. I'm learning so much, different things than I thought I would ever learn. But my life is so much better. It's so different, so much better. And at the end of the day, I feel like we made a difference, like we helped somebody. We've helped individuals with Parkinson's disease. We still have a client where both the husband and wife had Parkinson's disease. And I look at what those families are doing every day and doing it with such great joy and a little bit of help. And we have a lot of fun doing what we do. I have a lot of great, great people that we just enjoy every day and the funny things that happen. So life changes, and I wouldn't trade. I'm really happy where I am right now.
That's great. Thanks, Jean. I'd like to pose one more question, and then I would like to have some time to do some Q&A and time for comments from the audience. So my final question will be, any tips or suggestions that you can offer to other caregivers to make their lives a little easier? Julia?
So I would like to say that while I want to be positive and a cheerleader and inspirational and everything else like that, it's okay to be mad. It is okay to be damn mad, right? One of the things that I wish I would have, someone had just said the words to me earlier, where it's okay to be mad at the disease and not mad at your dad. Because I was mad at my dad for a little while, not knowing how to separate that. And it was a big weight lifted off my shoulder when someone said, be mad at the disease, not your dad. I just needed to hear that. And the other thing that I needed to hear is that my dad wasn't going to die from Parkinson's. So I was 35 when he died, I think, somewhere around there. It's fading now. But for 35 years, I lived every day wondering if today was the day my dad was going to die. And that's a heavy burden to live through. And so I wish someone would have said, he's not going to die from Parkinson's, and he's probably not going to die today. Could he die from a complication from Parkinson's? Yes. I wish someone would have said that to me much earlier than when I learned that. So my tip is, you just do the best you can with what you have, you know? That's it.
Thank you.
I'm a great believer in finding resources for support. As I said, I'm a big mental health person, so people have different levels of comfort with this, but I say get a therapist. By all means, you need someone to, somebody said, well, you say talk to someone. He says, oh, I talk to people all the time. You don't talk to a trained person all the time. You need to talk to someone who's been trained to do this. And as you said, you know, you might not, the first one might not be it. You might need to shop around. I've had some that were okay, but the one I have now, I found like she was made for me. You know, she was just sitting there waiting for me. So, but it can be important to have someone that you can say things to. Your family might not want to hear your anger and your resentment and some of the things that you need to be able to express. So that's the first thing. And the second thing, I am a lover of support groups. I just think support groups, people who are dealing with the very same things you're dealing with. There's just nothing like it because there's so much you don't have to say because they understand. And so those are two of the main things that I tell everybody when at challenging times. And if you are a person of faith, that can be very important. I was in a workshop once where people asked when God became real in your life. I grew up in church and went to Sunday school and always believed in God. That was just part of but that belief didn't really become real in my life until my husband was diagnosed with Parkinson's. Someone had told me a long time ago, because I guess I tend to be kind of a take charge person, sometimes, Joan, you need to let go and let God. And I didn't really understand that, I think, until my husband was diagnosed and some of the situations and decisions and things I had to make. There were times like, I don't know what to do. I mean, I don't have a clue. And it can be so overwhelming that if you just, I'm going to let it go and try and, seek whatever your higher power is, or if it's spirituality or meditation, however, it can be helpful to try to just, let go and be open to whatever ever comes to you when you don't know what to do. And my experience has been that in my life, these later years with my husband and then my son also, it's like with the right attitude and support and everything, you can get some guidance when you don't have a clue what to do.
Thanks, Joan, and I think it's so important to talk about mental health, so thank you for sharing all of that. Eileen?
So ditto to Julia and Jean. Yeah, I would say to add to your talking about like anger and all, I think a lot of that anger and frustration comes from you want to be able to fix something, and you're angry at yourself, and then you take it out on your spouse, who hopefully just blows it off. You know, my husband would just blow it off, and he was fine. You know, and I would say, you know, I'm sorry, but you know, I'm just like so frustrated or whatever. But to add, my tip probably would be to stay active, to get your spouse as active as possible. You know, so often they might just want to sit back. I was lucky in that my husband was. He enjoyed the camaraderie. So, you know, you go through the big program, the Loud, and that's usually individualized, but then we had a GO program through our Generation Care in Muskegon, which would run for 6 weeks, and that was a combination of the big and the Loud program. So it brought all these guys together, or all these, you know, guys and ladies, and the camaraderie was good. They learned from each other. We had great therapists, all of that, just to keep moving and be active and encourage. If they no longer feel that they can get out to go to lunch, maybe invite a couple of their friends to come over and visit with them, you know. It's, you know, that social gatherings, social getting together, I think is so, so important.
And that's definitely important for all of us, so that's a great point.
Oh, yeah.
Thank you. Jean?
Ask for help. We've talked about it a lot. Ask for help, whether it's an agency, whether it's a friend, a family member, a therapist. But think about your environment too. We help many, many people age in place wherever home is, but there are things you can do now, later, sooner than later, to make sure that's possible. So just think about whether your environment is friendly to someone who has some mobility challenges. Do you have a master suite on the first floor? Do you have a shower that you can get into? Just simple things that will make life so much easier. Just think about the practical things too.
Great point, Jean. Okay, at this point in time, I'd like to go ahead and open things up to the audience for any questions or comments you may have for our panel.
Your buddy back there.
Thank you very much. Joan knows I was going to take the mic up there. She's in our Detroit support group. But I just want to say that my journey started with my husband, who his neurologist is Dr. Shana Kristeska, and she advised Curtis to go to a support group. So he went on his own, came back home and said, "It's Bring Your Spouse Day next month." Okay. So I go to the meeting. I don't even know how I became a facilitator. I just don't know how that happened. But then I got so involved that I love the group, and it's an outlet for me as well. And I support my husband in everything he does, as he does me. So this was just a regular stepping stone for me. So I just wanted to say that we've been married 36 years.
Congratulations.
Can I add something to that? I would just want to say, so my mother, who started a support group many, many years ago, my dad wouldn't go. He would not go. He said, there's just going to be a bunch of old people. I'm the young guy in the room. I don't want to see what I'm going to turn into. And that isn't the case. Everybody has a different Parkinson's disease. Mm-hmm. Not one is the same. But it was very hard for him to participate in that support group because he was so afraid that was what he was going to turn into. Well, many years had passed, and then my mom would come home from the support group and he'd be, "So what'd you talk about? Who was there?" Right? And he was very inquisitive. And then he became a regular attendee. When he got to the point where he was too sick and he couldn't go anymore, and he wanted to do something so bad. Dad, what can I do for you? What can I do for you? What do you miss? Do you want potato chips? Do you want a beer? What do you want, you know? And he says, you know, I miss that damn support group. I said, you do? And he fought it for so long. I said, why? Why do you miss it? He said, the camaraderie, the social aspect of it. They became my friends. I miss that. So it's really, really important, but it's a journey for everybody.
That's wonderful. Thank you.
Well, I'd like to talk about getting help and how important that is. I reached a point where I was so angry with my husband and I didn't realize it. And I went to see my pastor, and she suggested counseling, but she said, we also have a Stephen Minister program at our church. And I was assigned a Stephen Minister. You don't really get assigned. You find out if you could work together. The pastor's the only one that knows who's attached to a Stephen Minister, so it's all very, very confidential. And then I found out that anyone can get a Stephen Minister through our church. So if you would like spiritual friendship, because that's what it was, and she walked me through, she got me to look at our history. And when I looked at my husband and said, he's a child of God, that's how I need to react to him, it changed my whole perspective. And it was a wonderful, wonderful thing. But Julia had so much to share today, but Julia, share the fire station story of your mom and the fire station. It's a great getting help story.
So Jan's in my support group, so she knows that story. There's a lot of members in my support group that are here. I'm so happy to see that. So my dad would fall a lot, and my dad was a very big man. He was 6'3" and easily 250, 280 pounds. As a child, when he fell, there was, you know, here's a pillow. I can't lift you. But my mom went over to the local fire station and actually put on an index card and said, listen, you know, if you get a call from one of my kids here, he has Parkinson's, here's his name, he has no allergies to medications, he just fell and they need help getting him up. Please don't take him to the emergency room, I can't afford it. And they were wonderful. They made us feel, they became an extended part of our family. If he fell, he didn't have to lay on the floor for 3 hours until somebody came home. We could call them. And unfortunately, my dad's funeral ended up being on September 11th, 2001. And none of us really knew what was going on during that horrible day. But so many of those firemen came to his funeral. It was really very touching. So really thinking ahead and trying to what is best for my situation and asking is incredible, the results.
I'd like to just piggyback on what you said, and that is 911. It's free. When you call, I mean, if your spouse falls down and you can't get him up and he can't she can't get herself up, call 911. That's what your taxes are paying for. These guys were wonderful. When you call, all you just say is, my husband or my spouse has had a fall. We don't need the sirens or anything. We just need a pickup. You know, he just needs help getting up. And at my husband's funeral, a lot of them showed up as well. They were great, you know. It just, and they said, you know, don't feel guilty about this. Because at first, it was like I would depend on my neighbors on both sides. And they were like, don't you call the fire department, don't you call, you know. Well, then when they said, hey, this is where your taxes have been paying for all these years. Now, you know, be okay about it. You know, take advantage of us. So it was a life, I don't know.
That's a great point. Thank you.
And I'd just like to mention, in the city of Detroit, we were told to call the precinct, not to call 911. And I only did it once, but they were wonderful too. They came and picked him up, and they stayed and visited, and we lived in an apartment with a really nice view of the river, and they stayed for about 15 minutes. It didn't take them but a second to get him up, but they made an evening of it.
Thanks, Joan. Okay.
Do you ladies travel to speak?
I do.
Okay, can I have your business card
Sure,
after?
you can see me afterwards.
Okay, and then I just had really quick for Joan, when you were telling your story and you said that you pulled out all kind of information and you did research and things like that, and then your story stopped and you said, and I never looked at that stuff again. I wanted to hear more. Why is that
Well, when I didn't really do research, I got the information and I just kind of thumbed through it. It was overwhelming. It was too much for me. And so I put it back. So my journey was this kind of discovery as we went along, looking at all these, the books and the pamphlets and everything. I got a lot of stuff, and it was just too much at that time. I did it more slowly on my own. One thing would lead to another, and Dr. LeWitt was my husband's doctor, and we were getting excellent care and support that was just unbelievable. And I just want to share this one anecdote about Dr. LeWitt. When my husband fell and well, this is the best one to me, and suffered the closed head injury, I called EMS, and he went to the hospital through emergency. And you learn so much doing these things. And so with Parkinson's patients in the hospital, you probably have been told that, you've really got to go in there with a whip and a chair. And I called my husband's doctor, and he'd been seeing him for all these years, not Dr. LeWitt, but his primary. And I called him and I said, these people don't seem to know what to do, and I was very unhappy. And he said because he'd gone through emergency, it wasn't like the doctor had sent him to the hospital. So I learned about this. It was really terrible, and I was fighting and I say fighting, verbally and arguing and advocating for my husband. So finally I called Dr. LeWitt and told him, we were just having a terrible time. And he said, with hospitals and Parkinson's, it doesn't work well. And my husband had Parkinson's, but then he had the closed head injury, so there were all these things. And he said, a good friend of mine is chief of staff over there in neurology. He said, he's very busy. He said, but I'm going to ask him if he will answer some of your questions, because there was just so much. So I have a nurse friend who refers to some doctors as M-deities. The MDs are M-deities. So I figure the chief of staff of neurology at Sinai Grace. So the M-deity came down, and for 5 minutes, he sat knee to knee with me, and he answered every question I had, and I had written everything. And that's what Dr. LeWitt did for my husband. That was just one of the things that was just, I was able to get answers in 5 minutes that I hadn't been able to get in 2 weeks about a lot of things. So I just had to say that.
Thanks, Joan.
I have 2 questions. One is, how do you find out about support groups to find one? And if you have any advice about if there's better ones than others. I don't know anything about that, number one. And number 2 is, you guys were talking a lot about sort of, having gone through the entire, experience, but do you have any advice or stories about as the disease progresses and you run into things as a care partner that is frustrating and you don't know if you should try to push your person to do something differently, or if you just have to accept it about the disease, like asking them to, can you please say that again for the 20th time, in a row, or, some kind of other physical problem. You don't know if it's the disease or progressing, or if it's, you know, you just don't know how to handle that. Do you have any advice or stories about that?
If I can answer real quickly about the question about support groups available, the Michigan Parkinson Foundation has almost 80 support groups statewide right now, so we have quite a large presence throughout the state. If you check out our website, parkinsonsmi.org, we've got a support group listing there, or certainly feel free to give our office a call. I would be happy to send anybody out an information packet, and any other questions that you might have about our support groups, I'd be happy to answer those, and all of our support groups are wonderful, so no bad ones.
I can talk a little bit about the other part that you were mentioning about certain times in the disease or some things that you don't know how to deal with. My dad's speech was very soft, and but it's what I grew up with, and so I could understand him perfectly. My mom wanted to wring his neck, really. I mean, she could not hear him a lot, and this was an area where I remember this vividly. She would constantly speak louder, use your loud voice, repeat what you're saying. I cannot hear you. How do I know what you want? You know, she was very frustrated. She wanted to fix his problems as well, but she had a lot on her plate. So, you know, the good thing about it now is that speech therapy is wonderful, and everybody should be in speech therapy. Your voice is going to get soft. But for some reason, the person who has Parkinson's, we hear this repeatedly, they do not think that they have a speech problem. They can hear themselves, but no one else can. So it's just like another muscle that needs to be exercised in your body with speech, just like with LSVT or rock steady boxing or whatever exercise. It's important. I do want to mention, if I can, that Dr. Alice Silbergleit from Henry Ford, but it's not affiliated with Henry Ford. She just started a Parkinson's choir, which I think is fantastic. You know, so if you don't want to do traditional therapy, the fact that, I mean, who doesn't have fun singing? And you don't have to, from what I understand, you don't have to be a singer.
Good to know.
My husband was a barbershop singer, so that helped a lot. Oh. But a friend of ours in the caregiver group, she bought her husband a karaoke machine to help, you know, and so, and then she would invite others over to sing with him, but, you know, go back to like the 60s or whatever, the 70s, you know, and put that music together, and yeah, I think that would encourage a louder voice, so they keep practicing their loud.
Great, okay, I think we've got time for one final question or comment.
Yes, over here. I was wondering, sometimes you see the charts, like earlier today, about maybe, you know, within 10 years or so, you might see some cognition problems. So as a person with Parkinson's of 3 years, sometimes it looks like, oh, I'm just checking those days off here until I might lose my mind. It's a little scary. So I'm trying to operate from a place of hope, doing everything possible to keep my cognition, exercise classes and all that. So I guess what I need to hear are some stories of people that have lived with us a very long time that still has their cognitive abilities.
My dad did not have dementia. He did have hallucinations from medication.
Okay.
Did you want to try and say? Yeah, my
Anybody
husband had a little bit of dementia. I mean, and part of that was like when he, prior to heart surgeries and all, so he was on Aricept. So when he went into the hospital in the nursing home, and because the doctor said, don't take him off the Aricept, that might do more damage, even though he had come back, you know, he was doing much better. So something that I did hear, you know, several times from aides or nurses, or how long has he had dementia? And because his voice was faltering a little bit, you know, then they really thought that they equated that lower voice quality with dementia. So I think that's something if your spouse has to go into a nursing home or assisted living or hospital setting, write down on a big sticky note or something, this is my, say a few things about him and that he is cognitively okay, his voice quality just is suffering or whatever. But yeah.
One of my favorite clients at 98 and has had Parkinson's disease for many years is just as spunky as she ever was.
Thank you, ladies. I think that's about all the time that we've got for today. I would like to thank everybody in the audience and, of course, my wonderful panel members. Thank you all so much for sharing your personal stories with us. And I really hope that we can all work together to continue to bring attention to the importance of caring for the care partner. Thank you.